All right, everyone, welcome to our webinar. We are going to be talking about the COVID-19 virus and its relation to the immune system, nutrition, and traveling during the pandemic. My name is Joy. I'm one of the members of the Black Nurses Association, and I am the secretary, and I will be introducing our wonderful panelists today. First, we have Dr. Mary Amanda Haskins, an assistant professor of biology and health science program chair. She received her bachelor's in the paralegal studies and master's of health education from the Mississippi University for Women, the first state-supported college for women in America. She earned her PhD from the University of Mississippi in health with a concentration in health behavior and promotion with an area of support and nutrition. Courses that she has taught includes women's health, health psychology, nutrition, health behavior, and health program planning and evaluation. She also oversees all internships and a professional development course for majors. Her research interests include osteoporosis knowledge, awareness, and prevention, as well as other preventative health perceptions and behaviors and health disparities. Thank you for joining us today, Ms. Mary.
Okay.
Next, we have Kate Llanos. Am I pronouncing your last name correctly?
It's Llanos.
Llanos, okay.
You did good, though.
Apologize for that. She's a registered dietitian. She graduated from Stephen College, then went on to the University of Central Missouri and graduated with a bachelor's in dietetics and nutrition in 2020. She's currently at Kaiser University completing a Master of Science and Dietetic internship in nutrition. All right, our next panelist, and am I pronouncing this right, Dr. Lukman Khan? Excuse me. He is the owner and director of Chase World Travel.
Yeah, I'm not a doctor, I'm a travel agent.
Yeah, sorry, I read that incorrectly, Mr. He's a Chase World Travel that was established in 2009, operating as a leading business, providing all aspects of travel and excellent customer service to clients from different backgrounds. And they have more than 25 staff serving communities in various locations throughout the United States and around the world. Though travel has been very difficult during COVID-19, Chase World Travel has been helping travelers regardless of where the tickets are purchased. If you guys ever need any assistance with travel arrangements, you can call the toll-free number at 1-855-ASAP-CHASE or 1-855-272-7242. And lastly, we have Dr. Jessica Eaple Farmer, an assistant professor of agriculture and animal science research and extension at Lincoln University. She trained academically at Texas A&M University in cell culture and gamete handling, oocyte maturation, embryo culture, pregnancy transplantation, and immunology. Her reproductive research currently focuses on a new nanoparticle-based semen evaluation technique. Her immunology background has her serving on COVID task forces explaining epidemiology and viral biology. She's a lifelong teacher and taught classes in high school, college, and graduate levels such as biology, health, and anatomy. And she has a certificate in college teaching from Texas A&M University and served 5 years as a teaching assistant training and evaluation program coordinator for the Center of Teaching Excellence. Thank you for joining us today.
Thank you all and welcome to the webinar. I will let you get started, Dr. Eaple Farmer. The panelists will have 5 minutes at the beginning to share anything that they have to share with our audience, and then we will open up after each person has shared the first 5 minutes of anything they want to share with the audience, and then we will open up for question and answer, and at the end, the panelists will have about 3 minutes to wrap up and summarize what they want our audience to take home from this webinar. So welcome you all to this webinar and thank you. Dr. Eaple Farmer, go on ahead.
Okay, let's see. Sharing the screen.
And while she's doing this, Joy will be monitoring our Q&A session. Thank you.
All right, are you seeing my presentation?
Yes.
All right, so I have put this presentation together and I've given it in several different locations. What I'm going to do is Felicia is going to go through and share this with the audience at a later date by email. And I am just covering the highlights here. There are embedded videos and other things that you can go through and take a look at.
Thank you.
So focusing on the coronavirus. So a coronavirus, as many of you know, it's got its name because it's a virus that's covered in spikes. So it looks like a crown. So Latin for crown is corona. Now, there are there's lots of different coronaviruses out there. There are 7 of them that are known to infect humans. 4 of them make up the common cold. So you find them in the upper respiratory tract. 2 of them that we're familiar with are SARS and MERS. These are very deadly, and we've heard quite a bit about them because of the damage that they do to the lungs. So this is the lower respiratory tract. And then we are worried about now with SARS-CoV-2 or COVID-19, it affects both the upper respiratory tract as well as the lungs. So these are best transmitted in confined spaces. They have not had a single incidence where they have shown disease transmission from surface contact, because you're not getting a high enough viral load yet, even though they are concerned that it does survive different amounts of time on different surfaces. One of the characteristics of SARS-CoV-2 is that it's in the middle for mutation rates. So when you look at influenza, it will go through and mutates very rapidly, just like AIDS. HIV goes through and mutates very rapidly. The virus for COVID is very slow to the middle moderate side of how often they go through and will mutate, which is good for us because once we go through and get the numbers down around the world, we won't have to worry as much about mutation, not to the same extent that we go through and worry about, say, with the yearly influenza vaccine that we have to go through and get. Now, the COVID virus goes through and enters the cell. Most of you have heard that it enters the cell through the ACE2 receptor. This is why you don't find it very prevalently in small children and young adults, because they don't have a lot of that stress receptor on the cells. This is upregulated in people who have diabetes and those that have high blood pressure. Now, viruses are all going to go through and use your cell's internal machinery to make that virus, which is kind of interesting because that's one of the ways that we go through when we're using this mRNA vaccine. The new type of vaccine that's out, this is the Pfizer, BioNTech, and the Moderna vaccine. It uses your cell's machinery to go through and create the portions of the viral particles that you want your immune system to respond to. That's one of the reasons it was produced so fast. And that's also one of the reasons why we're able to go through and we'll be making have made the vaccine and will make boosters so fast to this form of virus. Now, after we go through and we're vaccinated, our bodies produce antibodies so that we can respond very quickly to the viral invasion, a lot of times before we get sick. But we do see out there that even after vaccines, people are still coming down with COVID. They're just not as sick, and they've not had any deaths yet from people who have been vaccinated and have gone through and gotten COVID. So there are lots of different variants that are out there now. We've heard all about the UK variant, the South African variant, the variant in Brazil. As a matter of fact, a couple of weeks ago, the World Health Organization went through and changed the names of them. So I'll go through and kind of give you an update on those. But variants happen, mutations happen all of the time. Anything that's dividing, chances are there's some mutations that will randomly occur. These mutations go through and will produce variants. So both the Pfizer vaccine as well as the Moderna vaccine, they are currently making boosters to account for the known variants that are out there. Right now, your Pfizer, BioNTech, and your Moderna, through some of the existing variants that are out there, are between 50 and 80% effective according to antibody tests. So they're still really good. Some of the problems they're having with the Oxford AstraZeneca vaccine is that it's only 10% effective against the South African variant. Now, the World Health Organization, like I said before, has using the Greek letters to go through and to delineate the names of some of the different variants for fear that some of the countries feel bad if there's a variant that's known for them. Some of the variants of concerns that I found using the data that is as of this Monday, there are 4 variants that have been identified that are going through Missouri right now. So we have the UK variant, also known as the Alpha variant. It makes up about 80% of the cases in Missouri right now. What I have here that you are seeing, the plus 82, this Alpha variant is about 82% more transmissible than the original COVID variant that came around, and it is about 61% more lethal than the original variant that came through originally. Now, the South African variant, also known as the Beta variant, it has a 50% more, it's 50% more transmissible than the original strain that came through. There is no data out there on the lethality. The California variant makes up about 1.5%, just like the South African variant makes up about 1.5% of the cases that we have here in Missouri. It's known as the Epsilon variant, and it's about 20% more transmissible. We don't know about the lethality. The Brazilian variant is almost 5%, and it is known as the Gamma variant. It is 161% more transmissible and 50% more lethal than the original variant that came through. And finally, on my last slide, talking about COVID trends here in the United States as well as in the nation. So here in Missouri, if you see here in Cole County, we are still at the transmission level that it's very substantial. Up towards Columbia, you're going through and it's getting more to the moderate level. So we are still seeing active transmission that's taking place, enough to be concerned about. Another thing that they are looking at is trying to go through and getting enough vaccines in people that we can get close to herd immunity. Now, the formula for herd immunity depends on the average number of people that one person that's virally infected can go through and infect. Now, some of these new variants we know have a much higher transmission. So while initially they were saying that we needed 50 to 67% population to be resistant before herd immunity would kick in, so needing to have those vaccines, now we're up to 70% or so because of how transmissible these new variants are. Now, once we reach herd immunity, there's not enough of the variants that are being, or the virus that's being transmitted from person to person. So you have fewer mutations that are happening and fewer variants that are going through and forming. So right now, the Center for Disease Control is focusing on trying to reach the hesitant population. Because as you can see up here on the top right-hand corner, we really rapidly ramped up to getting the vaccines out. But after the middle of April, we pretty much peaked. And after that, we've been dropping down. This dropping down is not because we don't have enough vaccines out there. It's because we don't have enough arms to put those vaccines in. There's a lot of hesitancy out there for any number of reasons. So now we're focusing on trying to get people to overcome that hesitancy, figure out why they might be hesitant, and see if we can't go through and encourage our neighbors to get vaccinated. So we get closer to having herd immunity for those that cannot go through and get vaccinated themselves. Finally, down here is looking at national ranking of our states based on population to try to figure out who is fully vaccinated based on their percent. Missouri is down here on the lower 25%, I would say, and you can see that there are different counties around, but we're a lot closer to around 20 to 30% vaccinated on some of these different counties. I think Columbia is doing a little bit better But for the most part, especially when you're getting down towards the boot heel, the numbers are getting pretty low.
Thank
And
you.
that's something that we've got to worry about.
Thank you. Thank you, Dr. Epple-Farmer. Now we'll pass the torch to Dr. Mary Amanda Haskins.
Great. I'm going to bring my presentation up.
Thank you for that wonderful presentation.
Okay. So I'll be covering some of the basics, and one of the things that I teach in all my classes, I even have assignments where we find bad studies or retracted articles. But something to think about is that we're all consumers of information. And probably one thing, well, I'll look at a few other silver linings about the pandemic, but I think we probably are better consumers of information. We may be a bit more skeptical. And if coming out of COVID, we are more healthy skeptics, I think that's one of the more positive outcomes that we could focus on. And it can be quite confusing. I think this is the time too, with COVID, we are living through science. Because if you go back and you even look at some of the articles that were initially published from really good, reliable resources, the recommendations have changed. And I can't think of another time in my lifetime where I've seen the science around something health related change so quickly. So it's probably understandable that people might have questions about what makes a resource valid and reliable. And one of the things that I tell my students, and I tell myself too when I'm reading, is I ask myself the question, is it a study or is it a story? Because often if we're reading something in print, maybe from a magazine or a blog or something that's circulating on social media, it could be that it's a story that's referring to a study that has recently been wrapped up. And if it's the actual study, then you probably can put more stock into that information. So articles that are in like the Journal of the American Medical Association and information that the CDC tells us, a tip is to recognize that anything that ends in .org, .edu, or .gov is probably a valid and reliable resource. So one of the things that I've tried to do and share that you'll have available to later to look at if you'd like, are these health tips and resources. And all of these are good go-tos to give yourself an overview of not only COVID information, but any health, nutrition, exercise, mental health guidance and recommendations. The NIH, or National Institutes of Health, the Centers for Disease Control and Prevention, the World Health Organization. I've also included some top tier medical schools. So those are all some good sources of information. So I ask myself again, is it a study or is it a story? And if it is a study, sometimes I go a bit deeper and then I ask myself, well, is this something that's been published in a journal I trust, a medical journal? Or is it just a study that's completed that perhaps is not even being published? And maybe this is a PR piece. So I know I've become a much more skeptical reader as a result of COVID. And again, I'm also making assignments for my students out of that too. Something that you can ask yourself is, who is the author of this site? What is possibly being sold? What is the domain name? When was the last time that information was updated? And again, for some things, they likely won't change. You know, recommendations for how we can prevent ingrown toenails probably doesn't need to be updated so quickly as infectious diseases during a pandemic, where information changes by the month, sometimes by the week. And then you also want to ask yourself, how is that site being managed? Is it the purposes of being educational, or is it to sell you something? And again, that phrase, buyer beware, I think is also something that we can keep in mind again as we're consumers of information. You can get some really good information, not only from national agencies or health organizations, but the state health department and more local or regional ones as well. I know ones, I'll share the Missouri Health Department website at the end of this, but they have really good up-to-date information. One of the red flags is, if something seems too good to be true, if something is touted as a cure-all, you should definitely be wary of that information that's being shared on that site. So one of the good things that I read on this article from Johns Hopkins Medicine from their medical school, this was a recent article that has shared the lower rates of the common cold and seasonal flu being shared. So that means these health behaviors and habits that we started to form over the pandemic work. So, masking up when we're ill, being mindful when we have symptoms, to consider other people's health, potentially those who may be more medically fragile or unable to engage in some of the preventative behaviors that we can. Also being, I don't want to say hyper vigilant, but very vigilant about spreading germs, keeping hand sanitizer, washing your hands appropriately. Other things too that I've heard is now considered respiratory etiquette or respiratory hygiene, like coughing or sneezing into your elbow, and then washing your hands right after that. So these things have been beneficial in not only preventing the spread of COVID, but other things that are not so fun and that take away our sick days and time from work and time away from our family. So those things have been beneficial for preventing other infectious diseases. Maybe too, you've been having more conversations with your healthcare provider, maybe as an incentive to visit with family or grandkids. Getting your vaccine meant you also had an important conversation with your healthcare provider about getting your mammogram or also getting your seasonal flu vaccine. Maybe it's been a reminder to check in and see if it's time for your shingles shot or your pneumonia vaccine either. Possibly if you've had a new grandchild, it might be time that you're rethinking a booster for your measles, mumps, and rubella before you're around the babies. So these have been some of the good things. Some of the bad ones is the misinformation. So I wanted to go few of these misperceptions and also maybe right some wrongs. This is a myth about taking vitamin C supplements to prevent the common cold. So the research shows from the National Institutes of Health that it does not significantly decrease your risk of getting the common cold by taking vitamin C supplements. There are also some side effects that you want to be aware of when taking any supplement, and vitamin C is one of those that does have some side effects that you'd want to be careful with. Now, what you can do, what is a fact, is that you can get enough vitamin C from your diet, and it's beneficial for so many reasons to get a lot of fruits and vegetables. Not only are you getting vitamin C, you're getting other vitamins, minerals, and fiber too. So you are boosting your immune system when you choose an orange over maybe a less healthy snack, and that would be a really good behavior to continue. Okay, I saw this one, and it's a myth about nasal wash being effective at preventing COVID. If that's something that helps your allergy symptoms, certainly enjoy that, but it does not prevent against COVID. Neither do other myths like antibiotics, that's not possible. Neither do garlic supplements nor alcohol. So the Mayo Clinic was my source for that. So last one, you can enjoy protection against some of the COVID variants, as we learned after your vaccine, yes. So depending on the variant and the vaccine that you received, you can rest probably a little bit easier knowing that you're preventing the mutation of other potential variants. You can also reduce the complications in case you do, by a very slim chance, do get COVID after your vaccine. It would be less severe. And so all of those things should make you feel good about getting your COVID vaccine. And this great resource from Harvard Health Publishing reminds us that there are things that we can do that don't cost us any money to make sure our immune systems are able to fight not only COVID, but other illnesses too. And that has to do with physical activity, making sure, again, we're getting a healthy diet, when we maintain a healthy weight, when we get enough sleep, when we manage our stress in healthy ways, make sure we're keeping alcohol in moderation and not smoke. Those things promote a very healthy immune system for us too. So I think now is probably the time that I can stop, and I look forward to answering your questions later.
Okay, thank you. We'll have Ms. Kate Yenos introduce herself and then what she has for the audience. Thank you.
Hi, I'm Kate. I also have a presentation. Okay. So I wanted to talk a little bit about my experience with COVID. I'm currently completing my rotations to become a dietitian, so I'm not quite there yet. I just started studying for my boards on Monday. So through my rotations, I have to go to different sites, and one of those was Lake Regional Hospital. So I worked with a lot of COVID patients there, making sure that they ate because they lose a lot of their energy to do that, or they just don't have the lung capacity. It's hard to eat when you can't really breathe. So giving them supplements like a boost shake or something like that, just so they can keep nutrition up. That was some of my experience with that. I also worked in the ICU there. And then I spent about 2 months at Rusk Rehab. It's in Columbia. I don't know if everyone here is from Columbia, but it's a rehabilitation hospital. So they worked a lot with COVID patients after they had had COVID and they weren't contagious anymore. It really wreaks havoc on your body functions. So I worked with a lot of patients that were learning how to walk again, just getting back to their normal daily activities so that they can function around the house. At Rusk, they also took a lot of vitamin D tests when you came in. So they tested your vitamin D levels. And I noticed that with a lot of the COVID patients, they were low in vitamin D. I know that there's been a lot of information about how vitamin D affects COVID severity, and a low level can be more severe. I haven't read up on it as much as I would like to, but I did know that that was a correlation that I saw personally. And then I had a friend that had COVID in January, and she still hasn't gotten her sense of smell and taste back. So that affects nutrition a lot. It's hard to eat when nothing tastes good. So that's just some of my personal experience. So my recommendations to help boost immunity is, first of all, get vaccinated. I would also recommend staying active. That would be any kind of physical activity every day, even if it's just 30 minutes of walking. That can really help boost immunity. And then, like Dr. Haskins said, eating from the rainbow is a great way to get nutrients. So I listed a little bit of the differences because Mother Nature kind of coordinates what nutrients are in what foods based on what color they are. So if you eat from a variety of different colored fruits and vegetables, you're going to get a variety of nutrients. So just making sure that your plates stay colorful is a great way to get more nutrients in. And then I also wanted to talk about community resources in Columbia to help get some of that food. I know that a lot of people faced food insecurity through losing jobs, through COVID in general. It was just a tough year. So the main one that I know about is the food bank. They have pantries and congregates that they serve throughout 32 counties. So it's not just here in Columbia or in Boone County. So all of those pantries you can go, you don't have to prove income. You just have to prove residence in that area. And you can get food for free. They are working to make things more nutritional, but they do have a wide variety of options. They have a ton of fresh produce. I know that Columbia in particular partnered with CCUA, which plants a garden at the farmer's market. So they supply a lot of fresh produce. It really looks fantastic. So they also have the summer feeding program, which helps feed children between when school lets out for the summer and summer school ends. So, or summer school begins. So they're trying to fill that gap of when you're not getting breakfast and lunch at school for those kids. And they also have buddy packs. So those are little packages of food that have a couple meals to go home with the kids on the weekends when they're also not getting that food from schools. And then they have a commodity supplemental food program. So that's for seniors in the community. You sign up, you get a box of dry goods, I don't know, like dry milk, canned goods, things like that, monthly. And you can pick that up from, I know the pantries in Columbia, most of them are a part of that program. There's also WIC in Columbia. So that's for pregnant mothers, a year after pregnancy if they're breastfeeding, 6 months if they're not, and then children up to the age of 5. So they get a lot of nutrition education there, which is incredibly important because I think this country lacks a little bit on nutrition education. So that can be really valuable to help new parents navigate how to feed their children. And then another great resource in Columbia is the Voluntary Action Center. They are fantastic. They offer a lot of nutrition services, healthcare services, and then they have a ton of additional programs. They have a huge website that's really extensive and goes through everything that they do, but they are a great resource for Columbia. That is all I have.
Thank you, Ms. Yanas. And now I'll pass it over to Mr. Khan to talk to us about traveling during the pandemic.
I'm very honored that I'm here with intellectual people. Thank you very much. You invited me. So everybody knows that travel industry was the first one who affected badly in a pandemic time. So I want to tell you my experience, how we work with the people, with the airline, and how we survived until now. It was a very difficult time when the first cancellation we received on the 27th February 2020, when the Saudi Arabia said no more entry in Saudi Arabia, and people were there in the flight at Dubai in the transit, and some people reached there, but they all returned. So that was a big mess. So that time we got to know what COVID is. And I'm telling you my story that I was very much worried about, because we are the highest retail agency in USA. And we were very much scared about our business in the month of March. Then April, I was very much, scared about how I can retain my people. Like 25 people are working, how I can retain them. Then in the month of May, I forgot everything. At that time, I was more worried about myself, how I'm gonna live in the COVID time and save my family. So the situation was so tough that travel business from February 27 until I would say like December, we survived, even though now we are surviving. In the month of January and February, we got a good news from back few countries that they open the borders and they allow people to come in. But airline was reluctant. They were not ready to take people down there because they don't want to be the part of the COVID carrier. Even though like they open it January, February, March, the flight was operating, but you saw what happened in India. So India, when there is a COVID came, just because of the, there was so many people were positive in COVID, like in millions of people, and they were dying in every day, 5,000. All the airline, they stopped operation again. There was no flight going, only a couple of flights are going, who they are taking the necessary people from the India and back. So why I'm telling you this, because everybody has a concern how they're going to travel in a COVID time. Before the COVID, I always assumed that travel is a luxury, but in a COVID time, I realized travel is not a luxury, it's a necessity, because people want to go away. People want to travel and meet their families wherever they come from. People want to travel and enjoy their life and want a freedom, but they got stuck at one place like we are right now. So one thing I would say that the first thing was the good news we received from Pakistan, and they started a RT-PCR test. And nobody knows in our travel industry what RT-PCR test is. Maybe all the doctor panels knows very well. At that time, it was RT-PCR. We don't know other than that what RT-PCR is. And we asked people, okay, go ahead and do the RT-PCR test because it's required for the country of Pakistan before you're going to enter there. So at the same time, we had the kit, like rapid test kit. So people were taking the results from the rapid test. They consider that is the RT-PCR test whenever it's not. So people offloaded from the plane and they were not able to travel. So then we realized, okay, how are we gonna teach people, or how are we gonna help to our people to travel? And especially the people who bought the ticket online, they all suffered very much. Why? Number one, they bought the ticket. So I'm giving an example from the airline XYZ. Directly, they were, in my view, that 80% people are visual and 20% people are readers, right? So hardly people read and book the ticket. What I mean to say, they do read the flight of flight dates, flight timing and all that, but they don't read all terms and the condition because it's a long page. But at the same time, what was the difference between the online and physical travel agent? Like people calling one-to-one, they call us and we were summarize that and helping them out. But online people, they were very much confused. Where are they going to call? When they were calling to the airline, they were not picking up the phone. They were not returning the call, no email, everything jammed, right? So Chase World Travel really helped them out. Even they purchased the ticket with us or not. Even until now, we are helping them. We are a big support line for the passenger, whoever contacted with us, either they were our client or not, we are still helping them. So that is one of the good things we did. And I would say that is the blessing we have. And we are still a travel agent until now. And we are praying to the God, we're still going to be travel agent in future. So what I mean that why a travel agent, live travel agent is important for the traveler whenever the hurricane come or COVID type of things come. If you book the travel, you must have your personal phone number for the agent who you booked for, that you can talk one-to-one. Like you have, Felicia, your own experience with us, so you know better than anybody else.
Yes, I do. Thank you. Thank you. What you were, what Mr. Khan was referring to was when I traveled to Nigeria in December, they really helped me a lot. Nigeria was one of the countries that required that you do a positive COVID test before and have the result with you before you travel. And I wasn't aware of that. They were the ones who alerted me, and I was able to register and tried to get it done and got it done within 72 hours before my travel and got the result. But when I got to Nigeria, the flight, my original flight returning was canceled because of the airport was closed. So they were the ones who reached me to rebook. And that was why I was able to return the date I was actually booked to return. Without their help and direction, I would have been stuck in Nigeria, or I would have not been let into the country because I wouldn't know that I had to have the test before I traveled. So thank you, Mr. Khan, for that.
Well, thank you very much, Felicia. One thing I want to add that whenever, because we have a tons of experience, like there is a doctor sitting there. If a patient cannot cure with one medicine, so they advise the second one. So the same thing, like we have experienced, if the person's stuck traveling to somewhere, so we change their route, airline, because we have experience. So we guide them with our experience, how they're going to travel, when they're going to travel, and how they can save their money and time as well. Thank you.
Thank you. Joy, do we have questions to ask the audience, the panelists?
There are no questions at this time.
Okay, I have one right here from Stevenie. She said, she asked, can we take the Binax COVID test by Abbott before flying? Is this acceptable for travel to some countries?
The answer is no. You required RT-PCR test, period. RT-PCR test is the only authentic test required. Suppose if you're traveling from USA to anywhere, you can go any lab and do the testing. Suppose you're traveling to Nigeria, or you're traveling to Pakistan, or you're traveling to India or any other countries, airline will give you the list of the laboratories where you're going to go and test it, because they will not accept it. I'm giving you the recent example that is a bad example, which was happened in India, that 41 passengers were boarded with the negative test of COVID and landed in Hong Kong, and they all come out to be a positive test. So they banned right away, and Emirates Airline was the first one who suspended their flights from India immediately, because they do not trust their test. Now, they required a QR, important because there is a barcode in it. So they have to scan it. Airline will get all the information from the laboratory, because that's going to be authentic. And the countries like India and other. So what they were doing before, there was some people, they think they are very smart. They were changing the test on the PDF.
Wow. Wow, thank you for that. Okay, another question here. Thank you for that, Mr. Khan. Another question is, are there any travel tips? This is from Anne Maxwell.
Absolutely.
Any other travel tips that you can give to our audience, please?
First of all, you have to have your travel agent who has a knowledge. Do not book your ticket online, even my own website. Because if you have an interaction, you have a good travel agent, they will guide you step by step. Like I said, mostly people, we found like 80% traveler, they do not read everything. Maybe 20%. But I'm not sure even 20% they do read everything. So there is so many changes going on in the COVID time while traveling. We got information like a day before that, okay, no more flight for Pakistan. What are we gonna do? If you book the ticket online, can you change from Emirates Airline to Qatar Airways? No. The answer is no. You don't have that much knowledge available. But we know the art, how that will work. So I must say, number one, you have to have a good travel agent. Number two, you must prepare a couple of things that book in advance. That is very important. RT-PCR test is required. Some of the countries require like 72 hours. When you're coming back from any country to USA, they required 48 hours. It's not that you're going 72 hours and coming back 72 hours. So that is a very important information. You must have that. So the other thing that that is very common, do not please carry other people's stuff while coming back or before going. So that is very important, because we can see people, they try to help, but they bring so many stuff which is unknown and they got stuck somewhere. And after that, we are receiving the call. And the other thing is, which is other than the COVID I'm talking about, whenever you're carrying more than $10,000, must inform to the authority. They are not saying you cannot take it. You can take it, must inform the authorities, because I can see a lot of people are calling, okay, what happened? First, they try to hide. I always ask to the client, please tell us the exact story. You will save our time and we will find the solution, right? So when they are carrying more than 10,000, they hide it and they got in trouble. They missed the flight. They cannot put you on the next flight. So then you have to contact with us. You end up paying a lot of money for that. Please avoid those kind of mistakes.
Thank you so much. Okay, another question from anonymous person. The question is, please discuss how people can travel safely in COVID time.
As simple as that. Put the mask on, take the vaccine. I always say, first take the vaccine, then buy the ticket. Do not mistake. First take the vaccine, buy the ticket. Wherever you're traveling, vaccine is available in USA, all over. So go and take the vaccine and then buy the ticket. Very simple.
Okay, thank you for that. Okay, another question here. What are airlines doing to keep passengers safe? It looks
Well,
like all the questions are going to Mr. Khan.
So I'm telling you one thing, airline is extra careful. I spoke to one of the airline. They said, we don't want to be a COVID carrier. We're gonna stop flying wherever we can see a large amount of the COVID people are there. Like I gave you the example for India, right? So people are, airlines are not going there. So simple, airline is taking care of you very well. So they want, you have to take RT-PCR test within 72 and 48 hours on the return. So that is must, but you must take care of yourself first. If you're hesitant to take the vaccine, that you are inviting a death upon you. So please do not do that.
Thank you. Okay, more questions are coming. And another question says, what airlines are best for COVID traveling?
So that is, so travel in business class. So any airline is good, travel in business class. If you can afford it, do not save, spend money on yourself.
Okay, thank you. Thank you for that. Okay, another question. Oh, great job is a comment. Great job with the nutrition portion. So any other input until questions come on? Again, I've exhausted all questions. that are here. So if you, the panelists, have anything to jump in and share so far, go on ahead, please.
Hope panelists will not ask the travel question.
Oh, pardon?
I said, hope panelists will not ask the travel question.
If they do, you can handle that. So
I'm here.
yes. Any thoughts from the panelists?
So I can ask about the doctors, if they can explain about the PCR test and the RT-PCR test, so people will know more about it, so that if anyone can help, please.
I can answer that if
Okay.
no one else wants to.
Okay.
So PCR and RT-PCR, they're both polymerase chain reaction where they are using the existing DNA or RNA that's there to duplicate. Real-time PCR, the RT-PCR, allows you to go through and use a smaller amount and also check to see what is the concentrations that you're finding it. So it's not just an antibody test and you will get, it's far more sensitive. As a matter of fact, the RT-PCR test was able to go through and people would still test positive even up to 6 months after they had COVID, simply because they had enough remnants left inside of them that they would swab positive for. And that's why you would hear a lot of stories about people who after a couple of weeks, they would go and they were asking them to test twice to make sure 2 times in a row that they had to have 2 negatives. And it wasn't that it was leaving and coming back so much as that it was such a sensitive test that you're still clearing, even though you're better, you're still clearing some of that virus from your body. And so you will periodically shed a little bit. It's just not enough to go through. It's not a high enough viral load to be able to give it to somebody else.
Thank you.
Thank you. Thank you. Okay. Thank you, Dr. Apple Farmer, for that. We have more questions here. Okay. How do you convince someone who is reluctant because of the vaccine quick development?
What we try to convince them is, if you look at the numbers of what's out there and the number of, the nurses and doctors, the hospital staff were some of the very first people to get the vaccines. And so you see, with us being the first ones to go get the vaccine, if we felt comfortable with it and were successfully made it through, then surely just wanting to get back to life as before would make it safer than going through and getting the virus. And I know a lot of people were concerned about the blood clots, but the incidence of blood clots for the women in Pfizer was so much lower. It was 1 in a million for the blood clots for women with the Pfizer, and you have 1 in 100,000 for blood clots in women that take the birth control pill.
Yeah.
Most women in their life have taken the birth control pill, but you just don't, you don't see the difference in those numbers.
Yes. Yes. Thank you. That's a good one. Okay. Question from Lisa Andrews. What guidelines to travel to? Do you have any guidelines that you know of for someone who wants to travel to Ghana?
Very simple, like I explained you before, right? We are getting information on a day-to-day basis. So whenever you plan to book the ticket, that time that we have, whatever the information we have, we will give it to you immediately. Like we are giving you journal information, you require the RT-PCR test. So I'm giving an example. If you book the ticket today and you're traveling after 1 month, so before 72 hours of your departure, mark your calendar, you will call to your travel agent. If there is any changes or new update, please do get that and follow guideline at that time. Now, today we got a very good news that CDC says 110 countries, you can, they lift the restriction on 110 countries, so you can fly there. And I can see that Athens, like Greece is one of them. They allow you to come and enjoy your summer over there. And for the US national, they put a very limited, very less restriction on that. So whenever you're going to call, you will like it and you will enjoy and you will buy the ticket. But it's not a mean that if you purchase a ticket today for Athens, whatever the less restrictions we have today, it's going to be applied the same thing in next 14 days or next 1 week. Because during the COVID time, we have seen every day there is so many changes. So that is very important. The first guideline is to keep in touch with your agent until your travel starts, like 72 hours before departure.
Thank you. Thank you for that. Okay. Next question. Is it true that children are now being admitted more often since they are not getting vaccinated? So anyone can take the question.
Yes, you are finding more children that are being admitted now than were before. It's more high, the strains that are going through are more highly transmissible. Also, when you're looking at the ratio, because all of the adults are going through and getting and have been vaccinated, you were seeing the children hadn't been vaccinated. And so you had a higher ratio because the adults had been vaccinated and you have fewer adults coming in. With us lifting restrictions, if it is still transmitting around, you're starting to see some of the children getting it.
Okay, thank you. Joy, do you have any questions on your side, please?
The most recent one, I'm not sure if you just said this one or not because the audio went out for just a moment, but one of them, is it true that children are now being admitted more often since they are not getting vaccinated?
Yes, that's what she just answered.
Okay, then the next one is, how do you know who is vaccinated in the stores now with everyone taking their masks off?
You don't. You just have to get vaccinated so it doesn't matter.
That's a good answer. You just have to get vaccinated so you feel safe. If anyone around you is not vaccinated, but you are the one safe. And if they don't have their masks on, they are putting themselves at risk.
That is the message I am giving into my advertisement, because we speak like Punjabi, we speak like Hindi, Urdu. So I put a message: do not buy ticket until you get vaccinated. So in my language, I used to say that vaccine lagao te ticket katao. If someone understand that, so they must follow that phrase. Vaccinate. Vaccine is very important for our life.
Thank you. Thank you. That's so true. Okay, thank you. Joy, I think there's one more question on your side. Or two.
How do you convince a parent to vaccinate their children if they are reluctant themselves?
Sometimes you have to go through and convince the child or convince the adults around the child. So maybe the grandparents. Some of the communities that we're working in to try to overcome vaccine hesitancy is we're using some of the elderly that were the first to get vaccinated, and we're very grateful to be able to get vaccinated, helping them. You're very grateful you are taking care of your family and helping them help their children and help their grandchildren want to get vaccinated. And so maybe a parent might decide, I don't want to do this for me, but what they'll do for their kids might be completely different.
Yes, thank you. That's a very good
In addition to that, tell your children, if you want to go to Disneyland, take the vaccine.
Thank you. That's a good one.
But usually it's not the children that we have to convince. It's the middle-aged parents that need the convincing, because the elderly are 100% on board with wanting it. And the children have heard enough about it that unless they're hearing a lot of scary things from their parents, they want to get life back to normal, back to what they remembered, and they want to get it.
Absolutely.
Some of the unique or, kind of scary side effects of COVID that have uniquely affected children is higher rates of type 1 diabetes. That is never before seen. So there's some other significant side effects that seem to uniquely affect children that aren't being seen in adult populations. I think hearing loss was another one, and it's not significant, but when it's your child, it would feel significant. So, I don't feel that scare tactics work, but that those are part of having all of the facts. And that's been in the research. If you're willing to maybe just do a quick search, but the type 1 diabetes correlation with children who've had COVID is a scary fact to consider, along with some of the other more serious long-term repercussions.
Thank you for that. Joy, I think there's another question on your side, and you can speak to that if none of the panelists can. Go on ahead, Joy.
Next question is, how do we address mental health issues during the COVID pandemic?
The last webinar we had in April was about COVID and mental health, and it's on our Facebook. And do any of you have any comments to add to that question?
Yeah, that's unique. And I think there are multiple populations that their mental health has been affected. For some people, it might be someone who's elderly and is more isolated because they don't have someone who is a caregiver, because that person now is maybe homeschooling their children or has to take a second job to make ends meet. So I think people have felt more isolated. There have been increased rates for women having postpartum depression because they do feel more isolated and have in their pregnancy, from even some of the early research that came out about COVID. So I think every population that was at risk is now at higher risk. One of these silver linings I would presuppose is to say that people might feel more comfortable now using telemedicine or telehealth. It's quite feasible to get virtual, maybe just an initial consultation. I think that helps people maybe feel more comfortable their first time if there's still some stigma around getting help, even in the first place. It's quite easy to do that now virtually. So I say, don't be afraid to take advantage of any resource, whether it's online or in person. Again, that's not a substitute long-term, but I say that's one of the good things is that people can use telehealth and telemedicine. The same preventative strategies that help you reduce your risk for COVID are good at preventing other diseases too. So keeping your weight in check, managing your stress in healthful ways, those are things that not only help your immune system fight COVID, but are good for your mental health. So probably in doing those things, you'll reap many of the benefits and also prevent a lot of the physical and mental things that we want to keep in check.
Thank you so much for that. Anyone else has anything to add to that? Okay. I think we have some comments. Joy, can you share those comments for our questions?
There was just one comment, and it was talking about how it's become so political about the COVID-19 pandemic that people are starting to get very scared, just relying on like Fox News, CNN, other news outlets instead of getting the information from healthcare providers and other people who have more knowledge about these things.
Yes, that speaks to Dr. Haskins. Do you mind touching about getting information so people will not be scared? You did cover that in the beginning.
Yeah, this last slide, I have the dashboard for, you can look up your county if you live in Boone County or anywhere. And I would assume if anyone's out of state, there's probably every state's Health and Human Services website. I hope it's as up to date as Missouri's is. Oh, let me find it. Bring it up. But I have the county. Find it. Oh, it's not working really. One moment, sorry. The Department of Health and Senior Services, this link here provides a dashboard that shows all of the data. So the good news is numbers really, I'd say they shouldn't, but they can't really be politicized. Numbers are facts and figures, and they're not really open to interpretation. So you can use this link right here, and you can see how from day to day, you can assess your risk based off of the county that you live in Missouri. If you just need some good, reliable health information from the NIH, there's also topics under like osteoporosis, other nutrition, physical activity guidelines. But this is, I'd say, a really good place to get the facts because, again, numbers don't lie. And then from there, we can leave it to the epidemiologists to assess our risk and to tell us what are appropriate behaviors based off of those numbers.
Okay, thank you. Joyce, I think there's more comments or questions.
There is one question at the end. How high is the COVID-19 rate in Cole County currently? If anyone knows that.
You are muted, sis.
I don't know the rate, but they have it listed as moderate. So it's one in my presentation. It's one step below, and that was as of Monday morning. So we're at substantial for the transmission level. So we're still in the orange as they go from red, orange, yellow, and blue for low. And we're at substantial for Cole County.
Wow. Interesting. Thank you for that. Any more comments or questions? Joy, on your side?
They're mostly comments, just saying thank you for the great webinar and that this information is encouraging.
Then I think there's last question. Can the presenters share their slide on the Mid-Missouri Black Nurses Association Facebook? That is yes. We will. We will share all the slides and information for the presenters tonight for anyone who wants to follow up and look more into the information. They will be free to access those on our Facebook. Can you share the, Joy, can you share the Facebook link? Is that possible for you to do?
Yes, let me copy and paste it real quick.
Okay. Thank you. So the audience, we're still, we have 10 minutes to the closing time. So this will be the time for us to go around again amongst all the panelists to share if there's one thing that our audience needs to take away tonight, what would it be? I will let you jump in whenever you feel comfortable. Thank you.
Get vaccinated.
Thank you.
I'd say prevention works. We've seen the impact that vaccines have had on COVID. Again, same with wearing masks and being wise about our hand washing behavior and respiratory hygiene. The numbers for the common cold and seasonal flu show that prevention works. And so this could be a really good motivating factor to maybe also get your flu vaccine, because, you know, the second season B is going to be coming around when we're not really on guard or not thinking about it. Maybe use this as an opportunity to get your doctor to check that mole that you haven't been asking about when you're getting your COVID vaccine, or schedule your mammogram if you've been putting that off. So just remember, prevention works. And the good news is it doesn't really just prevent just one chronic or infectious disease. You're reaping the benefits when you are taking care of yourself, because if your body's a temple, you don't want it to be the kind that's like crumbling and in ruins. You want it to be a really pretty shiny temple, right? So you owe it to yourself. Do that.
Thank you. Thank you.
From my side, it's a very simple message. Get vaccinated. You know why? It's not you want to travel. It's not only you want to save your life and your loved ones. There is, you must know that in the travel industry, there's a lot of people are not working. They are laid off. If you're going to get vaccinated, airline will operate regularly, and they will hire more people, and they will hire back those people who they are sitting at home. Trust me, we are living in one of the best country in the world, but they have a limitation, and we are hearing that they will stop unemployment in Texas. So if you will not get vaccinated, people will not travel, airline will not operate, and those all unemployment people will not be on the job. Do you really think they will get a job other than the travel agency, which they have a tons of experience? The answer is no. Now the doctor panels are sitting here. How many jobs you can create? You cannot hire like thousands of people sitting in your offices. You have a limitation. So please help and support travel industry. We need you to get vaccinated.
Thank you. Thank you for that.
My takeaway would be eat from the rainbow. It's the easiest way to get nutrients and to get a variety of them. So just make your plates look colorful, really.
And get vitamin D.
Yeah.
Go out in the
Go
sun.
outside.
Go outside
Yes.
and exercise.
Yes.
Absolutely.
Thank you. Joy has just put up the link and to our Facebook, the Mid-Missouri Black Nurses Association Facebook, for our audience to see. And all these, the recording for the webinar will be available in a few days on the Facebook, but the slides will be available tonight immediately. As soon as we receive them, we will put it on our Facebook for our audience to access and make available to others and share with their families and friends. So thank you so much. Yes.
Alicia, can I say, please
Yes.
don't turn my PowerPoint into a PDF. They will lose access to the videos that are embedded.
Okay. Okay. Wonderful. Just post it the way you sent it.
Post it as a PowerPoint the way I send it so they can watch all the videos if they want.
Okay.
Yeah,
Okay.
Felicia, my last comment to you.
Yes.
Thank you so much.
Yes.
Thank you so much.
You're
So you are a wonderful person that you invited me, and you are sending a very good message to everyone. I hope people watch and apply in their life.
Yes, thank you so much. Thank you. And I appreciate all the help that you gave me when I needed to travel to Nigeria to get my mom. So
And
thank you for that, because
you're more than welcome.
when the pandemic hit, one of my concerns was not being able to travel abroad because most of my family are abroad. It broke my heart. My biggest is not the sickness, but am I going to be able to see my family again? That was my biggest concern. And until I was able to contact the World Chase Travel, I will put the information also on our Facebook for people to reach out to them if you need help for traveling. I was able to reach out to them. I've been using them in the past, but they were amazing. They have been amazing, but that period, they really gave me the best, I don't know how to explain it. They made my dream came true of going home to see my mom who was sick and who I didn't know if she was dying or gonna be better or if I was ever gonna see her again. Making that possible for me to travel during that time in December, that was a huge thing for me. And had it not been for their help and information and guidance, I would have been stuck or got to Nigeria and not be able to enter. So it's very important, listen to the advice for the tips that he gave us. So thank you so much, Mr.
Thank you
Khan.
so much for trusting on Chase Will Travel. And thank you very much again that all the doctor panels, they really help during the pandemic time and helping to other people. I really appreciate that. Thank you so much from my side.
Thank you. Thank you, Dr. Apple Farmer. Thank you, Kate Yanis, and thank you, Dr. Haskins, for coming. And thank you, our audience, for being a part of this. And have a wonderful summer and travel safe and get vaccinated and make sure you eat right and exercise and go out in the sun. Thank you. And have a good night, everyone.
Thank
Good
you.
night.
Good
Thank
night.
you.